Thank you, Adam, and good morning, everybody. As has already been alluded to, it's really difficult to actually help people back into the workplace or actually help them remain in the workplace when they're actually struggling with the mental illness. So what I'm going to go through this morning is just some of the activities and things that we take within our income protection team, so both our group protection and also our individual income protection products. So we know many of the statistics around the cost of mental health to the UK economy. It's very well documented. You've got 18 billion absenteeism costs. You've got 33 billion costing to UK employers, and ultimately 94 to 99 billion cost to the UK economy. And also the statistics for individuals as well. We know that 15 million working days are actually lost per year. We've actually got 300,000 individuals leaving work, as was identified in the Stevenson Farmer Review, the Thriving at Work Standards recommendation. That's a significant number of people that aren't contributing to the UK economy. We see different statistics. 1 in 4, 1 in 3 of the workforce actually experiencing mental illness at any given point. And we know the World Health Organization is actually saying that across the global impact is 300 million individuals struggling with mental illness at any given point. But what has already been stated this morning is actually, it's not all those statistics. What's really important is that it's 1 in 1. We all have mental health, and as Debbie has alluded to, and Luke and Lizzie earlier on, it's where we are on that continuum and where we are, whether we have good days or bad days. And that's what's key. And that's the focus that we actually looked at when we actually brought in our approach to dealing with mental illness when we're actually looking at income protection claims. And what we do is we actually place the person right at the heart of the actual interventions that we're actually providing for them. So that is the bedrock of our entire rehabilitation philosophy. And it's tailored individual care that actually is delivering more than just an insurance policy. We're actually looking after and caring for that individual. We use 3 pillars to this. The first one, prevention. Second, early intervention. And the third, comprehensive treatment and return to work support. So prevention, or as we rather call it, prehab. So what does prevention actually incorporate? Well, within our group protection product, we've actually got an integrated EAP, an employer assistance program, that we actually use with Health Assured. So that means individuals can have tailored intervention programs. They can actually use their own health assessments. We also look at financial well-being. So financial well-being is really important, as has already been alluded to, that a lot of individuals absent from work is down to financial problems, or when an individual then becomes absent from work, is the financial impact of them not actually obtaining a salary. We actually want to include a mental health programme within an integrated health and wellbeing programme. And that should be looking at the mental wellbeing, the financial wellbeing, and also the physical wellbeing. Again, as has already been alluded to, they are not in silo. They should be taken completely so that we can actually provide a holistic programme for everybody in the workplace. So awareness, engagement and access. These are some of the statistics that have actually come from Health Assured, our EAP provider. And you can see some of the impact from presenteeism, work engagement, life satisfaction and workplace distress, and the impact that having access initially to a good EAP provision and telephonic counselling and face-to-face counselling can actually provide to individuals within the workplace. You can actually see improvements in each of those measures once an individual has just had the ability to talk to somebody about their own mental struggles. Digital is a massive way in which we can actually provide scalability. Nowadays, individuals can actually own their own mental health strategy using apps such as the one provided by Health Assured. And they can actually have triggers on there identifying when they're having good days or bad days. We actually look at using the mental health index as well, going from 1 to 10. 10 is where you're having an absolutely amazing day. I think I'm yet to experience that. 1 is where we're feeling really, really low. And what we do on a daily basis is actually look at how we're feeling from 1 to 10 and just sharing that. Again, as has been already spoken about, it's about communication, being open and honest within the workplace and talking about mental health. We launched our Not a Red Card campaign back in 2017. So for those that haven't actually or aren't aware of it, you can see all of the information on the hashtag Not a Red Card. And that was actually using sport and aligning it to the workplace because, of course, sport is a workplace. And we actually use that anomaly to help really get the message across about mental health and that it is okay to talk about it in the workplace. We shouldn't be frightened of it. We should be talking exactly the same way as we are about physical conditions. We know how to talk about physical conditions from a really young age. We know when we need a plaster. We know when we need to see the GP. We know when we need to go to the hospital. But we don't have the same conversations about mental health. That has to change. And there's been a huge amount over the last few years working together with the Heads Together campaign, looking at mental health and opening up those conversations. But on that actual website, there is a huge amount of information that we can provide to employers and to individuals about best practice, what is good practice, because ultimately work is therapeutic and it is good for you. And we should be encouraging people to remain within the workplace. There's a lot of information that can be actually provided there. So early intervention. So what do we do when actually a claim happens? Across the industry, we've got numerous versions of deferred periods going from 1 day right the way up to 104 weeks on some of the group products. And essentially, early intervention is from day 1. We should be knowing about an individual's absence from day 1 so that we can actually put in place the right treatment and support for those individuals. So that we know that access to psychological therapies via the NHS using IAPT can take anything from 9 to 18 months, depending upon where individuals are within the UK. Now, in some instances, they're really good. It can be 3 months. It can be a lot earlier. But what we've actually identified is by working with a really good partner, we can actually provide psychological intervention from as early as 10 days. So within 10 working days of somebody actually telling us that they're actually away from work due to mental illness or that they're struggling, so either the employer or the individual themselves contacting us, we can actually put in place the right assessment. So we actually work with a company called CBT Clinics who will actually provide that psychological intervention. But to help that, we actually have an in-house team of rehabilitation specialists. We have 16 clinicians who actually are occupational therapists, occupational health advisors, occupational health physicians, physiotherapists, RGNs in mental health, but also cancer, trauma, and orthopaedic. And what we will actually do is we will talk to the individual and find out the root cause of their absence and actually talk to them and see what initiatives we can put in place. We will ask them to complete GAD-7 and PHQ-9 psychometric testing. That is self-evaluation, whereby we can then look at tailoring the right program for that individual to identify what psychological talking therapies can be put in place via CBT clinics. That comprehensive treatment and return to work support is ongoing. Once an individual undertakes that programme and the right treatment is identified for that person, they will have an assessment via CBT clinics, and that treatment will be automatically put in place, and it's actually funded for by us. No additional premiums are incurred. The reason we do this is because we know, as I've said, work is therapeutic, and by actually helping people to remain in work or get them back to work either before or shortly after the end of that deferred period is in everybody's interest. It's good for the individual, it's good for the role they're undertaking, whether they're employed, whether they're self-employed, and it's good for the employer if they are actually employed. That's a really positive message to get through to individuals. Our rehabilitation team will actually work with the provider. So from outset, the expectation is set that we're actually going to be working with you to help you get back into the workplace. We will then put in place the right treatment, whether it's 6 sessions of CBT, EMDR, or whatever that treatment is appropriate, using NICE guidelines, which actually recommends a maximum of between 20 to 24 sessions. But we would tailor it in that individual care pathway for that person. Our average number of CBT sessions is 10 currently, but that does fluctuate. So right from outset, we've got the CBT therapist actually being the patient's advocate and working with them. We've then got our clinicians who are employed by Legal and General working with the employer, working with the line manager, and working with colleagues, if an individual is employed, so that they can actually go through and help them back into the workplace. Because often that is one of the biggest barriers, is our HR teams don't know how to put together return to work programs. That's not what their focus is. They have a lot of other things on their plate that they have to deal with. But our specialists can actually sit down with them. They can actually hold the meetings with the individual, and they can actually sit down and work through what the right return to work program looks like for that person over whatever period of time from a graded perspective. They will also talk to colleagues because, again, often people don't know how to talk to somebody when they're coming back into the workplace. For whatever the reason is, they just don't know how to initiate that conversation. So we can hold those conversations with the individual, with their consent, of course, but with colleagues and line managers to actually help with that return to work program. And these are some of the results we've actually been achieving as a result of all of that work that we've been putting in place. So this is from the GRID surveys last year. Actually, it's 2018 because we're just waiting for the 2019 ones to come out. But we can actually see that our active intervention is really having some positive impact on helping people remain within the workplace. You know, we provided over 3,000 sessions in 2018 to actually help people stay at work. And I think that's really positive. As we've already stated, it really is positive to have those conversations, to actually stay within the workplace, because that contributes to the UK economy and actually helps individuals' self-esteem, because that is one of the most important criteria. Thank you.